My name is Jen Pope. I'm an emergency physician. I'm also the chair of St. Luke's Emergency Department. We are a group of physicians, physician assistants, and nurses who are honored to care for this community. We see a little over 93,000 patients a year, putting us at the top 3 in the state busiest community emergency departments. As Dr. Rocha mentioned, unfortunately, we saw over 450 overdoses last year, and that is just the tip of the iceberg for us. These numbers do not include the numbers of patients and families we see every single day, every single shift who are affected by this disease. I'd like to share a little bit about the kind of patients and how this is affecting them emotionally and physically, and also talk about our responsibilities as providers. So on a typical shift, most recently actually, I saw an 18-year-old who had fallen off his bike and had hurt his wrist. He wore his helmet, he did not hit his head, he did not lose consciousness, and he came in with some mild wrist pain. I did a full history and physical, and on exam he had a little bit of pain at the end of his wrist here. I gave him some Motrin, his pain was well controlled. I did x-rays. He had a very small fracture that would not require surgery. He was placed in a splint. I arranged orthopedic follow-up for him, and I wrote up his discharge instructions with a prescription for Motrin. And as we went to discharge him, his parents came to me and said, "Why aren't you giving him something stronger for pain? This is not enough." The next patient I saw was a 24-year-old female who was there with arm pain. Before I went to see her, I noticed that she had a fever of 102 and her heart rate was very elevated. When I went to see her and approach her, she was shaking from her fever. And as I looked at her, her entire hand was swollen and it tracked all the way up her arm to her shoulder. When I talked to her some more, she did say that she had injected heroin 3 days ago. She developed an abscess and was just coming to the emergency department now. She had a very bad skin infection from the injection that now spread up her entire arm and had gone into her bloodstream, taking over her body. She needed aggressive IV antibiotics, IV fluids, and actually had to be admitted to the ICU where her blood pressure got very low and she was very sick from this infection. The next patient I saw was a 45-year-old male, and he was there because he had suicidal thoughts. When I went and I spoke with him, he was 45, he was married, he had 2 children and a strong career. He had relapsed on opiate pain medication, on pills. He had been on Suboxone, and unfortunately he was not able to refill his Suboxone prescription the week before and had relapsed. And because of this, he wanted to take his life. 2 more patients I want to tell you about. One was a 55-year-old female who came in unable to move her right leg. We immediately saw her and we noticed that she had a fever and back pain. As we talked to her some more, she had progressive loss of the ability to lose her right leg, back pain and a fever over the past 3 days. She did have a history of IV drug use but had not used in 4 months. And based on her exam, she had lost most of the function in the right leg. We emergently got her to an MRI machine and found that she had a large infection pressing on her spinal cord, and she had to go emergently to the operating room with our neurosurgery team. And we don't know the outcome of her ability to use that leg at this point. And the last patient I want to tell you about was a 72-year-old male. He came in with shortness of breath. Very nice gentleman. I asked him some questions on what made him short of breath. And at the end, I asked him 3 things that I ask everyone. Do you smoke? And he said, no, I quit 5 years ago. Do you drink alcohol? He said, no, I never have. Do you use opiate pain medication or heroin? And he said, yes, I snorted heroin I last used 2 days ago. So these are the ways that this disease is affecting our patients and their families. It affects the very young, the very old, the rich, the poor, and everyone in between, and no one is safe from it. So what is our responsibility as providers? As providers in the emergency department, we are expected to see everyone that walks in the door, and we need to assess people for acute pain. If someone has acute pain, we first use non-narcotic options for pain medication, but then some people will need narcotic pain medication to help with acute pain. And it is our responsibility to talk to patients and potentially their family about the risks and benefits of that. It's also important that we start a conversation at the level of the community, because it is all too common when we have pain to reach for a pill first and not to look for other options. And it is also our responsibility to talk to patients when we are concerned that they are demonstrating behavior that would suggest a substance abuse disorder. We are very lucky at St. Luke's Emergency Room that we now have 24-hour-a-day, 7-day-a-week social workers who are available within a few hours to see our patients, talk to them about our concerns, their concerns, offer them outpatient resources. And we do have patients who present looking for detox at that moment.